Now here we are. Here we are with my neurosurgeon, Dr. Sanjay Konakondla, and his physician's assistant, Derek Rockwell. And they're just going to explain a little bit why I'm here today at the Geisinger Neurosurgery Department, I guess, Neuroscience Department.
Okay, so what we have here on the computer is a mass around the spinal cord, okay? So we can go ahead and take a look at these areas here. This long black line here is the spinal cord. Spinal cord controls everything from arms and leg movements all the way down to sensation, and what we want to see is this long black tube here. When you follow this tube and you sort of see this construction site here, that's what we start to focus on, that little black circle there. Okay. And another way to look at that is a different type of cut right here. So if we focus here, we want to see as a nice round spinal cord and a lot of white spinal fluid around it. So if we follow that down, we start to see that this spinal cord starts getting pushed to the side. And you can see this mass now take up the space where the spinal cord should be. So when you have that pushing over your spinal cord, all the tracks get disrupted. When we find that mass, we want to make sure that it hasn't been there for a while by doing a CAT scan. If we do a CAT scan and it lights up, all this bright circular area in the spinal canal is that mass. So that demonstrates that that's calcified, so that's been there for some time.
So do we think that's cancerous, malignant, or benign, or we don't know?
So it's tough, you never know what it is until you take a piece of it and look at it under a microscope with a pathologist. It's always on the differential, but when we talk about statistically likely things, it's a little lower down on the list. Okay? So the goal is to just unroof that area, open up that circle, and sort of peel that mass away from the spinal cord and make sure the spinal cord has a lot more room.
Can you show where on my spinal cord that is?
Be somewhere around this area.
Okay. Here. I don't know what you call this thing.
This is a spine model. This is a thoracic spine. So we remove these areas, sort of pop the top off on both of these, and we start seeing this yellow thing. That yellow thing in that circle there is your spinal cord running down.
So you're going to take two pieces of my bone?
A couple pieces of your bone.
Spinal cord.
Good news is it's not in the joints or facets or anything, so you won't have any disruption or instability after that.
Okay.
So you don't have to do any screws and rods or anything.
Thanks for this one. We're going to do it on January 27th, I guess.
That's the goal.
Okay.
That's the goal.
Thank you so much today, and that's the ACE team that's going to be working on doing my surgery.
There you go.
Thank you much, guys.
You're welcome.